Welcome to the conference session titled In Sickness and in Health. This session is recorded, was pre-recorded by Dr. Isabel Schurmeyer. Thank you for joining us. My name is Julie Powers, and I'm the Senior Director of Patient Advocacy. As we get started, generosity of our corporate sponsors and the generous support of patients, families, and caregivers for supporting the conference today. Thank you for joining us. My name is Julie Powers, and I'm the Senior Director of Patient Advocacy. As we get started, sorry, everyone, I had a little bit of a technical difficulty. Back on track now. I want to thank the generous support of our corporate sponsors for their contributions to today's event, as well as to the patients, families, and caregivers who have made financial contributions to today's conference. Today's specialist is Dr. Isabel Schurmeyer, who is a psychiatrist at the VA Northeast Ohio Healthcare System. Her special interests are psycho-oncology, bioethics, psychiatric side effects of cancer treatment, and improving adherence to medical treatments in the cancer population. Dr. Schurmeyer also serves as the chair of the AAMDS Patient Education Council. And now, Dr. Schurmeyer.
Thank you so much, Julie. Sorry I couldn't be here live with you all, but I'm so thankful to the AAMDS International Foundation for hosting me today to give this talk. A lot of times we focus a lot on just the medical complications of illnesses, and we don't talk more about the human part of being subject to what's going on medically. And so one of the things that as a psychiatrist, I spend a lot of time talking about with people is how you're going to manage your relationships. Things can change. And so we're going to talk about that. We're going to talk about ways to stay connected that are going to be comfortable for you, especially in the setting that we're in now. So just as a quick overview, with any serious medical illness, we know that a relationship can change, whether it's with your family, whether it's with friends. It can happen in your work setting. It can happen with, acquaintances, people you don't know all that well, and your relationship with your medical team, with your healthcare team, usually will dramatically change. Most people, you've got a doc that you know, and that's who you see from time to time. When you end up with a serious medical illness like MDS, you end up spending a lot more time hanging out with doctors. And that's going to change that relationship. Most often, you're going to need modifications in the communication style. And so we talk about doing different techniques, some that could be uncomfortable even, to help manage these new situations. We want the techniques to be as comfortable as possible. With that being said, whenever you try something new, it can be potentially difficult. So the goal for today isn't to take you from being somebody who doesn't like to talk a lot to being, somebody who's talking all the time. That's not our goal. Our goal today is to help you recognize what challenges you might have, what modifications might be helpful, but it's not to try and completely change your communication style, because everyone has a communication style, and you should stick with what you know, but you might need to do some small changes and learn some new techniques to add. All right. So, and as a quick side note, Lee Clark is going to be helping me with some role plays in a little bit, just so that no one's surprised. So, just a few key things with good communication. First of all, you want to know what your goal is with the communication. So what is it that you're talking about? Is it that you're going to be talking with, your medical team? Are you going to be just hanging out with your best friend? Are you going to be, telling your kids that they can't do certain things? So you want to know what your goals of the communication are. What are you comfortable sharing? So that can vary person to person. You want to have an idea of how you can tell somebody you don't want to talk about certain things. So, I have a lot of patients who come to me and they say, Dr. Schermeyer, I don't want to have to talk about you know, my need for blood transfusions, or I don't want to have to talk to people about what kind of treatment I'm going into. So what are some good phrases that you can just turn to quickly, that you can just, pull off the top of your head so that you can just turn to that when somebody kind of puts you on the spot? And then if you know in advance that you're going to be having um, some sort of communication that's going to be difficult for you, plan ahead with questions or points you want to make. And I put over here doctor's appointments, because a lot of times people tell me that doctor's appointments can be very anxiety provoking and can be really, really difficult. And they feel like their communication with their doctor doesn't go as well as they had hoped. And that's something that as a psychiatrist I never want to hear, because um, you know I want people to be able to communicate effortlessly, in fact. Although I do know it takes effort. Okay, so just a couple thoughts. You want to pick words carefully, because saying the words can be very hurtful, and you want to be cautious with that. And so if you don't know what the right thing to say is, acknowledge that. Just be super upfront about it and say, I don't want to be hurtful. I just want to understand, or I want to be able to be helpful, and I don't know a better way to ask this. So, so you know, be cautious. So, with those warnings in advance, one thing we do know is that imperfect communication is better than no communication. We know that isolating people is exceptionally, exceptionally hard for humans. Humans being reasonably social species, um, that it's much better to have imperfect communication. And so, one of the things that I hear a lot from patients is they either
Welcome
have
to
too little communication with their friends and family and others, or they have too much. And everybody sort of wants that, just right in the middle. It's kind of the, I think, Goldilocks, Three Bears scenario. So we don't want too little, we don't want too much, we want it just right. And so it takes a little bit of work to get there. All right. So let's talk a little bit about family. So here's some of the things that I hear from family members, or from my patients when they're talking about concerns with talking with their family. They don't want to worry their family. Or I'll have family members come and say, I don't want to ask too many questions. I feel like I'm stressing them out. I don't want everybody asking the same thing. And so there's some of the techniques we talk about managing are, what would you like to know? And then ask if they're comfortable talking about the illness. So as I mentioned earlier, we're going to do a little bit of role playing, and I'm going to ask Lee to join me. And in this scenario, Lee is going to be my sister. Hello, Lee. And basically, she's going to be the person with the illness, and my concern is I don't want to ask too many questions. Okay, Lee, I know you've had a really rocky day today. And I know that people have probably been asking you like millions of questions. And I know that mom and dad have probably been asking you lots of questions too, but I was wondering if you would be willing to talk with me a little bit about what's going on with you medically.
I do this all the time. Everybody's always asking me about my illness. It can sometimes be really stressful because I feel like nobody ever just asks normal questions of me always comes to my illness.
Yeah,
About,
and I think
about what's going on
part
with
of
you
it is that
medically.
everyone's so worried about you. We just want to know what's going on.
Always
I
asking.
wonder what you would think about the idea of there maybe being like one person you could tell everything to, and then like that person could be like your spokesperson.
I think that would be great. I think that that would allow everyone to know what's going on. And then, because I really just want people to treat me and for us to have the interactions before everyone knew that I was ill. I'm more than just my illness. I'm still your sister. I'm still a daughter. I'm still a friend, and all of that. So I sometimes get very worn down with all everybody wants to talk about is that I'm ill. And I'd really like to talk about things like, what are we going to do next weekend? Or other things that are happening in my life that don't revolve around my illness. So I think that that would be great. And who would you suggest would be the best person that maybe could handle all of that? Because I don't want to burden mom and dad
Of
with any
course.
more things than what they already have going on in their own lives.
Right. And so certainly I don't like the idea of mom and dad either, because I mean, and I say this as nicely as I possibly can, they're not really tech savvy. And I was thinking maybe we could do something that would involve tech so we could get all our cousins, like everybody, because I just keep getting calls from, cousins and aunts and uncles asking me how you're doing. And the fact of the matter is, I don't even know how you're doing.
I think that's great. Thank you for thinking of that and helping me. It means a lot to know that you care.
Well, of course. So I was thinking that I could be the person who takes that over. Or if you don't want me, we could ask like our brother or some other family member. I mean, whoever you're really comfortable with.
Sounds good. And maybe I can send what I'd like for you to communicate to everyone, like in an email. That way, you know exactly what I think is okay for you to let people know,
Right.
and how I want to communicate about what's going on with me. That way it's easy on you, because this could be a lot on your plate as well. And that way there's no misunderstandings of what I want people to know. Because I like to tell people in my own way and in my own time what's going on with me.
For
Some
sure.
things I'd like to keep just private.
Of course. And I think that makes just a ton of sense. And of course, I'd want to respect that. But I think another thing that would be a good message to just put out there for our friends and family members is that, you don't want to focus on your illness. So, just hang out with you, pretend like, it was before you even were diagnosed with this. And, let's talk about other stuff.
Yeah. And I love that everyone cares. And I don't want to diminish, everyone is being worried. But sometimes all of that is very exhausting for me as a patient. It's, one more thing I got to try to manage. And I just want to try my best to have the same relationships that I had with everyone beforehand without this added stuff, because it can be very stressful.
Mhm.
um I have a lot going on, trying to manage doctor's appointments and treatments and all the other things that are going on, but I want everyone to know how much I do appreciate everyone. And I think this was a great way to focus on meeting everyone's needs, but also knowing that I've got to take care of myself and my needs. And my emotional well-being
For
as
sure.
well.
Absolutely. All right. So scene break. So what Lee and I just did there, it was probably not the most realistic of any conversation that you'd see in a family, because she and I have been working in this field for a long time. And so that's kind of maybe the more perfected version. However, we covered some of those main sort of points, which is, what things do you want communicated, and who wants to be in charge of the communication, and what needs to be put out, and who's going to make those decisions. And some of those things, I mean, all of those things are really important to discuss openly and transparently. Um, and it, she was very thankful for everybody being worried, but she also was clear that she really wanted to have her life go back to how it had been before her illness, which is something that we can't have happen. However, what we can do is we can find a way to inform the family and friends and allow some of the time that they spend with her to be not focused just on her illness. So with that's probably what I hear most often when we talk about family. The other challenge that I get not as often are concerns with your spouse. And so I hear sometimes, I don't want to be so much of a burden on my spouse. So I don't tell my spouse what I'm feeling, or I don't tell my spouse, what's going on with my treatment. And as I said before, imperfect communication is better than no communication. And whenever we talk about any sort of relationship, the minute you start kind of just withholding information, that's going to make it much harder to maintain the relationship. So a lot of times, what I'll say to my patients is, would you want your spouse to withhold that information from you? And more often than not, they'd say, of course not. Of course, I'd want to be able to help my spouse. Say, well, don't you think it'd be good to offer that opportunity to your spouse as well? And again, more often than not, my patients will say yes. But that is something that I'll hear when we talk about family challenges, with regards to being partnered or with a spouse. But otherwise, with siblings, with children, with parents, the most common things are, I don't want to worry my family, and family members don't want to ask too many questions. Moving on to our next, which are friends, which Lee had already sort of given us a little heads up on. She don't want to focus on my illness, don't know what to say. So, some of the techniques to manage are deciding in advance what you would want to talk about or what you're comfortable talking about. And then coming up with a phrase that's easy for you to say to redirect the conversation. And I've had patients pick all sorts of different phrases. It can be anything. It can be, so what do you think about the weather today? It can be a whole host of things. And then for people who have a friend who are really ill and they don't know what to say, acknowledge that it's difficult not knowing what to say. There are plenty of situations where there's never going to be that perfect thing to say. And acknowledging that can be a good segue. So I'm going to ask Lee to join me again. This time in this role play, Lee's going to be my friend. All right, Lee, you're going to be, did you want to be the person with the illness, or you want me to be the person with the illness?
Sure, I can be your friend. I'll be the friend.
Okay, and I'll be the person with the illness?
Yeah.
Okay.
Hi, Isabel.
Hi,
Did
Lee.
you,
It's so good to see you.
good to see you too. How's everything going with your aplastic anemia?
Oh, it's going really great. Thanks for asking. How are things going with you and, world peace?
Oh, you know how it is. Have you started your treatment yet?
I think it'd be great for us to talk about your interest in world peace.
Oh, have you had any side effects yet from your treatment? I just don't know what's going on with you, and I'm just so worried, and I just need to know.
And so I really think I'd like us to focus on your interest in world peace. And so I'm going to do a quick timeout. And so while I know that was ridiculous going with world peace, I have had patients who have done that and just been like, that was actually one of my patients did that, where if a friend started in with, I'm so worried, I really want to know, blah, blah, they just they picked world peace and they were just like, I just want us to focus on something else. And if their friend kept coming back, they said, it's clear to me that you don't really want to talk about world peace. So I'm going to go and I'm going to go talk with one of our other friends instead. Um, which can be really, really hard to do. However, sometimes sometimes even if you say to people, I really don't want to talk about my illness. I'd like us to talk about something else. Even then, sometimes people are unwilling to take that. Lee, what sorts of things have you heard works when people are kind of hyper focusing on illness?
I think the main thing is just for patients to set boundaries. I mean, your your friends, I always think, are in different pockets. You have your very close friends, then you have friends that you see occasionally, and then you may have acquaintances. So I think the level of what you share is going to depend on where those friends fit into your circle of everyone. And I mean, everyone does care, but sometimes it can be hard to redirect
Mm-hmm.
um, the conversations. And you always want to make sure that you want to maintain your friendships. And sometimes, a lot of times with what we hear from patients here at the foundation is people really don't understand their illness.
Mm-hmm.
They don't understand that, they hear a lot, oh, you look great. And
Mm-hmm.
they don't really understand that on the outside you do look well. You may not even look like that you have an illness, but they don't understand what's going on the inside is wrecking havoc
Right.
um on yourself. So a lot of times it can be difficult to help friends understand why you can't go to lunch or why you maybe have to decline some of their invitations or things like that. So it can be hard maintaining those friendships of folks that maybe are not in that close inner circle with everyone. So sometimes you do have to be direct or do your best to explain, and you share only what you want to share, and people have to understand that you have a lot going on for yourself.
Absolutely. And I think that brings up some really good points, Lee. So one thing that I've heard from a lot of patients is that is that some of their really close friends, once they became ill, weren't as close anymore because they had a hard time with with coping and with communicating and being supportive actually during the patient's illness. And some friends that they hadn't been as close with came in and were very supportive and were able to communicate really well and were very, became closer friends. And so we talk about how how serious medical illness can change relationships significantly. Um, and so, I mean, I think that is an important thing to acknowledge for sure. I mean, I think another thing, you know, is being upfront about not saying what you want to talk about and what you don't want to talk about. So having those really good boundaries, but also understanding that, sometimes people will be very uncomfortable and they won't know what to say, and they won't understand what bone marrow is or bone marrow failure, or really any of that. And so the fact of the matter is reasonably complex. Um, and and for many of my patients, they don't want to go around explaining all of that. However, sometimes it can be very helpful to do that. So sometimes it can be really helpful having somebody who can do kind of the PR for you, or be like your spokesperson, who can say, the diagnosis is MDS, or the diagnosis is aplastic anemia. And what that means is X, Y, and Z, and just do it in a very simple way. And then say, there are going to be days when Lee looks really great, and there are going to be days when she's really feeling terrible and horrible. And, this is why. And so doing a little bit of education can be really, really helpful as well. So acquaintances. So this is one of the things that I hear a lot from people, from my patients, is, they don't, well, for a variety of reasons, they don't want to go out to the grocery store, they don't want to go out to the kids' soccer game, or they don't want to go to, you name it, because they're afraid that they're going to run into so-and-so's parent that they don't know really well, but they know that that person works in medicine. And what's, are they going to start asking you lots of questions about the diagnosis? So how do people handle that? All right, Lee, you're on.
Oh, hi, Isabel. You may not remember me, but I'm Susan's mom. You went to college with her.
All
How
right.
are you doing?
I'm doing really well. Thank you for asking. How are you doing? How's Suzanne?
Oh, doing well. She told me that you have a blood cancer.
Yeah, that's a true statement.
How did that happen? We're just so worried.
Oh, I really thank you for your concern. It's really kind of you. Um, but we're here at this game, and I feel like we should probably pay attention to that. Would that be okay with you?
Well, you look great. I never would have known that you had such an illness. She says that you may need a bone marrow transplant. That has got to be so scary. Like, how does that work?
Thank you so much for your concern. I'm going to go back to focusing on this game, but can you please tell your daughter that I say hi?
Well, sweetie, if you need anything, you let us know. Um, I will see you, but you look great. You wouldn't even know you were sick. Are you sure this is serious?
I think you look great too. I'm going to go. Bye.
Well, bye.
So, Lee, Lee is awesome at being persistent in that. Um, I think most people are able to walk away a little easier. However, yeah, just sometimes people can be very intrusive, and just being able to say, I I'm not going to discuss this. I'd rather do this. Um, can be helpful, but being caught off guard can be tough. However, with that being said, I do think that um, that what Lee did was approaching and saying, you know, hey, like if we did that scenario again and said, hey, you know, I'm Suzanne's mom. I don't know if you remember me, but I saw you and I just wanted to say hi. Suzanne told me that you've been pretty ill. I just wanted to come by and say hi. You know, I think because many times I will also see family members and friends, and people will talk about how uncomfortable it is to run into somebody who you know is going through treatment for a serious medical illness, and you don't know what to say. And so I think it's important to at least acknowledge that you know them, that you know that they've been ill, and just at least have some communication. All right, moving on. So colleagues and coworkers. So this is what I hear from most of my patients. Everybody wants to know when they can return to work, whether it's my patient or their colleagues and coworkers. Everybody wants to be helpful. And also the usual don't know what to say. So whenever we talk about managing these situations, we talk about knowing the laws. So there's different laws depending on your employer and the situation that you're in. Decide in advance what you're comfortable sharing. This is always, as I think I have on every single slide. Um, but know the laws, and also, you know, and we haven't gotten to communication with your healthcare team, but what I tell my patients, because I have a fair number of patients who are very eager to get back to work, um, and that makes a lot of sense to me. Uh, the American society is very work focused, and so it can be hard for people to not be able to return to work immediately. So I've had patients who've gone through like a bone marrow transplant, and like the day out they're out of the hospital, they're like, I can go back to work. I'm like, well, what does your bone marrow transplant team say? You know, what is everybody suggesting would be the right next move? Um, so so I think it's an important thing um, to understand the desire that patients have and what their colleagues, coworkers have. But also, I think it's critically important to know the laws. Okay, Lee, this time you get to be the patient. I'll be me. Lee, when are you coming back to work? We miss you so much.
Oh, I don't know. I've got some things I'm taking care of.
I know, but seriously, like we miss you, and like you're the supervisor.
Oh, I miss everybody too, but I've got some things I need to, take care of.
Yeah, but are you healthy enough to come back to work?
Well, taking it one day at a time, and I'll be back as soon as I can.
Do you want to come back to work?
I'm taking care of some things, and just dealing with things right now day to day, and I got to focus on some other things at this time. But how are you doing?
I'm doing okay, but you know, we all miss you so much. And the assistant supervisor who's taking your spot, we don't really like him. So,
Oh, well, I'm thank you for the kind words. And how are things going with you? Did you guys finish that project that we were working on?
oh my goodness, that project has been delayed and delayed and delayed. I'm telling you, it's crazy.
Oh, well, I really got to run. But it was so great to talk to you, and I'll be in touch with everybody soon, and I tell everyone I said hello and I'm thinking of everyone.
Okay, but just remember that we miss you so much and we need you to come back as soon as you
Oh,
possibly can, okay?
well, thanks so much. And you guys take care now.
Okay, you too.
All right.
Bye.
Bye.
All right, so Lee and I ran that, I think in probably a more ideal way than is realistic. However, many times I will have patients say to me that they really, really, really feel pressure to go back to work before they feel ready to, um, or patients who want to go back to work before the medical team says they're ready to. And so it can be very uncomfortable. All right, so let's talk about communicating with your medical team. So as I alluded to at the beginning, um, most people have a doctor that they work with on occasion, but once you're diagnosed with a bone marrow failure illness or really any serious medical illness, you're going to be hanging out with doctors, with a healthcare team a lot more often. And so the things that I hear most frequently from my patients are things about not talking about the topics that are most important to the patients, not being able to understand what's going on, and time. And so one of the things that I encourage all of my patients to do, in fact, this is something I encourage everybody to do, is to, before the appointment, is to think about what the most important topics are, rank them in order. So like, what is your number one most important topic? And write it down. And that way, when you are in the appointment, because typically with most doctors' appointments, you go in, you sit down, they're going to do your blood pressure, they're going to check your heart rate. And during that period of time, you can go ahead and pull out your notebook and have it there and ready. Refer to your notes throughout the appointment. And then if you don't understand something, say, listen, I don't understand. And if that doesn't get you clarification, say, I'm very confused. But coming up with a phrase, which can be just as simple as I just don't understand, can be something very, very helpful. And I'm always I'm always sort of taken aback because there's so many people who don't want their doctor to know that they don't understand. But the fact of the matter is that their healthcare team has spent a lot of time in school to understand these things. So a lot of this is really complex. And so asking for a clarification makes a lot of sense. Time. So yes, as a doctor, I understand the pressures of time. However, you can ask your doctor, can I have an appointment that's a longer length? Can I speak with somebody else on the team? Who else can help us on this? All right, so I've got Lee again. Lee, who do you want to be in this role play?
I'll be the patient.
Okay, I'll be the doctor. All right, Lee, I've got the results of all your lab work here, and I just want to tell you that I think everything's looking fantastic. Really happy about it, and I think we're on the right track. So we'll have you come back in about 2 months. What do you think?
Well, I looked at my labs and some of them are low and they've been low. You keep telling me that I'm fine. I don't feel fine. I keep telling you I don't feel fine. I don't think you're understanding I'm suffering from symptoms. And could you please get your hand off the doorknob? Because I find that very upsetting that you seem to focus on lab work and you're not focusing on what I'm telling you as a patient. And I don't understand why we're we're not having good communication here. I understand about the labs, but I need you to focus on what I'm saying. And you never seem to have time for me.
So let's replay that a different way. Hi, Lee. I've got your lab results.
Okay.
Wait,
And how do they look?
you be the doctor and I'll be you.
Hi, Isabel. I have your lab work.
Okay, before you start, because I already know that you're going to want to try and leave, and I know because I've already looked at the lab results, you're going to say that they look fine, and I appreciate that. But I think what's really important is that every time I come in here, I try and explain to you that I really don't feel well. So is there a chance that I can either have a longer appointment? Is there a chance that I can meet with a different person on your team? What choices do we have for me to go through my symptoms? So one of the reasons why I did that differently was to show just two different ways of managing that, because one is one way, both ways are going to be challenging, right? But one way, you're very upfront. You don't even let the doctor continue. You just sort of jump right in and say, listen, I know what you're going to say. You're very predictable. But this is what concerns me. And I think that can be something that can be a really good wake up and a good way to just start the conversation and just say, before you start, I think it's important for you to know that I've already looked at my labs. I already know what you're going to say. But I think it's really important that you understand my concerns.
And I think sometimes too, patients should make the appointment about what their agenda is, not
Absolutely.
start with their agenda first and then let the doctor give
Yeah.
what it is that they need. So it may be just setting up the pattern that you start out with what it is that you need in the appointment and then turning it into
Right.
what the doctor needs from the appointment.
Right.
And maybe suggesting sending your concerns in advance,
Right.
by an email or something like that if possible. And sometimes you may need to consider, is this the right medical relationship for you? Maybe if you continue to have this, maybe you need to seek another expert to help with managing your health.
Right. And I mean, I think that's the thing that's important is that you recognize that that you recognize what you need out of the relationship, and how you like to communicate, and that you're able to do that. So because I have other patients who don't want to know, they don't want to know their labs, they don't want to know any of the details. And so if you have a doctor that says, I want to go through all these labs with you, and the patient says, no, I really, I don't want to hear any of that. That also needs to be a situation where the healthcare team needs to be able to understand that, for some patients, that's a limit for them, where they can't really handle hearing some of that. So, all right, so we've covered some of the big groups. So I think in summary, what I just want to leave you all with is that giving some thought to how often and what type of communication you want is a really good idea. And practicing different techniques can be really, really helpful, because a lot of relationships will change over time, whether you have a serious illness or not. And it is critically important to all relationships to have good communication. So yeah, so I appreciate Lee for all of her role playing with me. Thank you. And I appreciate you all for participating in my session today. Enjoy the rest of the conference. Thank you so much. Bye.
Thank you, Dr. Schurmeyer, for sharing your time and expertise with us. And thanks to Lee for role playing with Dr. Schurmeyer. If you'd like to watch this session again at a later time, it will be available on the conference platform in the next hour or so by accessing the session and clicking on replay, or by navigating the on-demand
Appreciate you
tab
all for-
in the platform hub. Be sure to visit the exhibit hall. The next session will start in approximately 15 or 20 minutes. On behalf of AAMDSIF, thank you for joining us today and for making us your resource of choice for information on bone marrow failure diseases. The AAMDSIF Medical Advisory Board, Board of Directors and staff are here to help you and your family as we have for the last 37 years. This concludes the session. Medical Advisory Board, Board of Directors and staff are here to help you and your family as we have for the last 37 years. This concludes the session.